So before we move on to the next topic, I just realized we forgot to discuss, I don't know if you want to have a contained discussion about social media dating and swiping. Do you want to get into that?
Yeah. So social anxiety, specifically romantically, how that ties in with loneliness, how the anxiety that springs out of loneliness manifests in compulsive dating app use.
Sure.
This is a common problem that I'm seeing amongst my patients.
Okay. Can we maybe add in there the effects of literally swiping through 150 people in a day?
Yes.
So, you know, back when I was single and I was on dating apps, right? I noticed it was kind of almost turning me into a sociopath in a sense, because here I am swiping through 100 people, and I would start to just swipe left on girls that I would just be like, her eyebrows, like little details that really just, they're not significant in the grand scheme of things.
Yes.
But because you're seeing 150 people a day, now all of a sudden your baseline, your rubric for like what's an acceptable possible mate is just ridiculously out of touch with what's really going on out there.
Yeah.
So,
well, there's so much to talk about as far as like dating apps and like the problems with it. Now, caveat, there's the other side of the coin. Dating apps, they have their positives, of course. We won't get into that right now, but let's talk about the problems. And what I tell with my patients, listen, we're here to talk about the problems, right? Yeah. You're talking to a shrink here. So the problem that arises out of having unlimited options and choices and swipes is that we start discriminating on such a strict rubric as to who is acceptable and good enough and worthy of our attention. That is a major problem. Humans are not built for this sort of accessibility to potential dating mates in this sort of volume.
I think they said in that book Tribe that it's somewhere around 150 people or so that the human brain is meant to actually interact with and take in on a personal level, and everything outside of that, it starts to
150 is the magic number as far as like who you can kind of be familiar with to the point of being in your community and tribe. Absolutely. And I think if you ask anybody just walking down the street, is it pathological or does it spring forth problems to be able to swipe through 100 people a day? The answer, of course, is yes. Now, this also this directly relates to a major problem that kids, people, adults have in their dating lives these days, is when they encounter some sort of conflict or problem or imperfection in the relationship or the other people, they, in their mind, think that, hey, I got 20 other matches I can go look at. I got 100 swipes a day I can go sift through. So why try to compromise or accept a fault or work through some sort of conflict with the person I'm dating when Mr. Perfect is just one swipe away?
Yes.
People are fickle in their relationships these days.
Would you say that's a bad thing?
Yes. Categorically. Bad.
So maybe people should try to empathize, mentalize a little bit more.
What would my advice be?
Authentically interact with someone.
A perfect relationship needs to be built. So if you find someone that you have sexual attraction to, because again, this is a sexual relationship, lust should be it should be and is a prerequisite or a requisite for pursuing someone. So if you find someone that you have like this sexual lust for that aligns with your main values, then recognize that you are going to have to work and build a relationship that will be appropriate and sustainable and acceptable. You are not going to just run into Mrs. or Mr. Perfect. And that is something a lot of people these days are missing.
Yes. And just to put a cap on that conversation, it reminds me of this talk I heard from Jordan Peterson where someone asked him, how do I know I found Mr. Right or Mrs. Right? Right. And he said the exact same thing. He said, and I really like this, and it's been true in my relationship as well with my wife, like first date, definitely like sexual tension. When she walked up, I was like, oh God, don't screw this up.
Yes.
But then we had the conversation the rest of the night, aligned on a lot of things. And I said, oh my God, this is the first great conversation I've had on a date in like 4 years.
Yes.
Amazing, right? And so what Jordan Peterson said was basically finding someone that you're sexually attracted to.
Yes.
That you align with your values well enough. Everything after that, it's not finding Mr. or Mrs. Right. It's building Mr. or Mrs. Right. It's all about the relationship you build.
I'd be curious, what are these values that you guys had in common that was evident from the start of the relationship?
One of the fun ones was our lack of wanting to travel. When you're dating, I'm sure a lot of you can relate to this. You're swiping through different people on the dating apps and they're like, oh, I'm looking for my world traveler honey and all that. Well, that just sounds like torture to me. I'm not looking to travel. Traveling's a lot of work. It's tiring. It's exhausting. I'm more concerned with building my home life really well, having a good household, being integrated well with my family and friends.
Yes.
And
so the converse of being a big time frequent traveler is investing in your home life, your tribe and community at home. That is certainly a value.
Yes. And I just told her, I was like, listen, I'm down to travel, but I'm not trying to travel.
Yes.
And she was like, oh, thank God you said that. Me too.
Yes.
I was like, sweet.
Yes.
All right. That's one thing,
Yes. I totally understand what you're saying. Main lesson here.
What about you? Let me ask you.
So what values did me and my current fiance share? Well,
current fiance, might be another one after.
Hopefully not. Danny's going to request we cut that bit.
We'll cut it.
Family values. We both want to build a family in which that is the biggest family values, I would say. We both have the same religion. We both are intensely career-oriented and success-oriented. We're both ambitious. We're both very loyal. We both prioritize physical fitness. I would say, that is a good start. But I would say the family values, wanting to invest in the home life, wanting to be with our family, wanting to invest in our children, and recognizing that that is like the ultimate goal. Let me tell you, I see 15 patients a day. I've done 1,000 intakes over the past 4 years. I have a sense of what leads to mental wellness and meaning. People might spring up on me and attack me online for saying this, but what have I noticed talking to people literally all day, every day, is that having one monogamous, emotionally intimate, romantic partner and having children with that partner and forming this nuclear family is one of the biggest protective factors in getting depressed or clinically anxious or mentally ill in general. I'm happy to go on record saying that.
Sure.
Yeah. It might be controversial these days because all the loony ass shit that people are talking about.
Well, you're the feet on the ground.
Yeah.
Yeah.
But let me tell you, people that have a healthy, emotionally intimate, secure, monogamous relationship with children that they can invest in, and they have a meaning and purpose in life outside of just themselves and the pleasurable pursuits of their own life, usually don't have need for a psychiatrist.
I believe it 100%.
And if they do, it's usually not depression. It's usually some sort of like in-wired generalized anxiety disorder or this feeling of overwhelm or insomnia. But having your own family is absolutely a way that you can protect against a lot of mental illness.
I would love to talk about this more. We should save it for another podcast because this is going to be a whole another discussion. So we'll move on from that topic.
Let's move on.
Let us know in the comments if that interests you. And let's move on.
Let's move on.
I think it would be cool to talk about when anxiety can be a good thing. Because it's not always bad, right?
Yeah.
And you were telling me you had a patient that was overcoming some of the problems that you had been working on. And now they were having anxiety whenever they would deviate from their positive path and start to slip back into their negative mindset. They would start experiencing a similar anxiety that they were experiencing before. And they came to you and they were like, Dr. Mike, why am I experiencing this anxiety? I thought it was getting better. And you told them
it was a sign of progress.
It's a sign of
So
progress.
I know what case you're talking about.
Yeah.
I had a patient, ADHD, anxiety, depression. Now, if you guys watched a prior podcast, we talked about how to turn against defenses. Jeff asked me, how do I turn against and stop procrastinating? So I'll just reiterate it here. Procrastination is avoidance. That is a defense. How do I defend against something that is painful, uncomfortable, distressful? So I avoid. So Jeff asked me, how do we treat this? Step one, acknowledging that the avoidance behavior, aka procrastination, is a problem. Second, what has the cost of this problem, this avoidance been? I will have patients literally journal out, what is the cost of this avoidance been to my life? And what can it continue to be if I continue to engage in avoidance behavior moving forward? Once patients have done this and they recognize that their procrastination and avoidance is a massive problem that has caused them like great cost in their life, personally, professionally, socially, they start to turn against it. Now, this patient was again engaging in avoidance behavior. The battery in her car was out. She had to call AAA and get them to just change the battery. Her cousin from out of the country was coming in a week later and she had to drive him around, and she has been avoiding calling AAA for 4 days. Now, she was so anxious that she was literally vomiting. She couldn't sleep.
Wow.
And she's like, Dr. Mike, what the fuck is going on? Why am I so insanely anxious? Now here, she has engaged in this type of avoidance behavior for the past 30 years.
Yes.
Has it ever caused this level of anxiety? No. Why is it causing this level of anxiety now? Because she has identified it as a problem. She knows the intense cost of this avoidance in her life and the cost that will continue to be paid if she engages in this behavior moving forward. She is now engaging in it now and she's consciously aware of it. And her body is now picking this up as a threat.
Her anxiety as a threat.
No, her avoidance behavior.
Avoidance as a threat.
Her avoidance behavior is being picked up as a threat because of the risk of it continuing to engage in this avoidance behavior. She has already outlined the cost of it. So now that she is engaging in this avoidance and she's recognizing how big of a problem it is and how big of a cost it's come to her life, it now registers as such a big threat. And what is anxiety? It's threat detection. So now her anxiety gets so elevated that it's going to compel her to act.
To do the right thing.
To do the right thing.
Yes.
So now we have shifted her mind to recognize the defense as a threat. So her compulsion is to do the healthy thing and confront, because as she sits in her avoidance, it is literally making her sick. So here is a great example of the fruits of our labor.
And you make sure that's clear to her. This is a positive thing.
Absolutely.
Listen to your anxiety in this case.
And here we have an example of pain is part of progress and turning against defense, aka avoidance, and how peaked anxiety can be a signal of progress and turning against this defense of procrastination and avoidance.
The way I can relate to that is with eating healthy and working out, right? I like to drink and have a good time with my friends, right? If I'm making a lot of progress in the gym, then if I go out at night and I'm thinking about getting a drink, it's going to cause me anxiety because I'm going to think, oh, it's going to throw off my progress tomorrow.
You know the cost of the alcohol
I know the
consumption.
cost of it, right? It's going to throw off my I mean, I'm not deadlifting. Because if I'm hungover, like I'm not trying to deadlift, and that's going to throw off my whole plan, you know, everything I set out for myself this week. But it's a good thing to recognize that.
Yes.
So I don't have the drink. I just have a normal dinner without the drink with my friends, and I go have a great workout the next day, and I continue on my merry way, and it's a healthy form of anxiety.
Here we have an example of holistic psychiatric care, right? These are the things we work on. Defenses, the cost of defenses, like avoidance, how to turning against it. This is so much more than just, hey, take this pill, see you later, right?
100%.
This is holistic psychiatric care. How do we cure the patient? How do we extinguish self-defeating behaviors? And how do we make meaningful change, progress, and growth to get ourselves out of depression or anxiety in a more permanent way?
Okay, we've touched on a few different ways that trauma can affect people and manifest itself in different ailments. I would like to briefly touch upon how trauma manifests itself in OCD. Maybe not briefly. Let's talk about how trauma manifests itself in OCD. Maybe talk about a specific case you had where that manifested. And also, let's briefly explain to the listeners why OCD is one of the most extreme cases of anxiety.
Okay. So let's put some, as everybody knows, I'm really into defining things. So let's define trauma, and then let's define what an obsession is. And we've already defined what a compulsion is, but we'll cover that again for those watching. A trauma is some sort of physical or emotional injury or event that overwhelms our capability of regulating it, handling it, processing it, and it causes a shift and a change in our nervous system. So that is something that is traumatic, something that is overwhelming us physically or emotionally that causes sustained change in our nervous system.
Do we understand at all the mechanisms by which a trauma or physical injury could result in a mental?
We do. I mean, if you look at like MRIs and scans of patients that have PTSD, you can see literal changes in the structures in our brain that have to do with fear, like the amygdala, for instance. Scan a bunch of PTSD patients, compare them to normal, healthy, non-traumatized patients, and you will literally see changes in the size of the amygdala, the fear center, part of the limbic system in those patients that are traumatized. So part of the definition of something that is like clinically traumatic is that it causes an actual change in our nervous system, our body, our brain. Trauma, the word trauma is like tossed around a lot these days very casually, but that's what a clinical trauma is.
Good to know. That makes perfect sense.
What is an obsession? A clinical obsession. An obsession is a recurrent, intrusive thought that is distressful of a particular theme. Meaning, I don't want to think about this, but it keeps poking its way in. It's causing me a lot of distress, and it's of a particular theme. So that's what an obsession is.
Mm-hmm.
When someone gets obsessive about something, it causes distress. Oh, I'm obsessed that like this is going to have germs on it. It's not clean enough. I'm going to get sick. That causes me to feel very anxious and distressed. And that anxiety, like we've discussed a million times already, can drive behavior. I can feel compelled to engage in a behavior just to relieve the anxiety of that obsession, like compulsive hand washing, for instance.
Okay.
So that's a basic kind of definition of what's a trauma, what is an obsession, and what is compulsive behavior. So your question is, can trauma lead to obsessive compulsive symptoms? Absolutely, it can. Now, I've seen this so many times in my practice, I could pick a bunch of case examples. So let me outline one. 60-year-old male, no history of obsessive compulsive disorder, any sort of clinical anxiety, had a urological issue with his prostate, had to get some sort of medical intervention. His prostate was really enlarged, had to get like a whole procedure about it, and then needed a catheter, a tube up his urethra into his bladder that allowed him to void his urine during the recovery process in which his prostate could heal.
This hurts me already just listening to it.
Yeah. Now, this guy went home. Again, 60-year-old male, no history of clinical anxiety, has this catheter up his urethra that he needs in order to urinate. He unfortunately has trouble like putting in the catheter at home, despite a bunch of instruction by his nurses and doctors. He now finds himself with this intense urge to urinate, and yet he cannot get the catheter up his urethra, so he can't drain his urine. Ooh. He is now in this great state of panic and fear because his bladder is totally full and he cannot void. This guy is scared to death. I can't get the catheter in. My hands are shaking. I'm in the middle of a panic attack. How the hell am I going to get this urine out? My bladder is going to explode. I'm freaking out.
Oh, talk about a nightmare.
Nightmare.
Oh.
He ends up going to the emergency department. Some of the doctors even have trouble putting it in. Finally, they get it in. He's all good. Regardless, traumatic. I feel physically like my life is in danger. I feel powerless to help myself. Powerlessness and the inability to help yourself is a major component of things that are traumatic. Now, what's spraying out of this? He now gets obsessed about urinating on time. He sets a timer. I need to make sure I urinate every 75 minutes. He's tracking the amount of urine that comes out of him to make sure that he's voiding properly. He's waking up overnight to make sure that his bladder does not fill to the point of being an emergency.
So it's impacting his sleep, and we all know sleep is very important, as previously discussed.
It's impacting his sleep, and he is all of these intrusive, worrisome thoughts about being able to urinate. So trauma, hyperarousal. I am so in tune to my ability to urinate and how often I'm urinating. His vigilance. I am on the clock making sure that I urinate every 75 minutes. He's tracking all of these things, so he starts obsessing. Again, it's recurrent, it's intrusive, he's at work, he's getting about his business. Oh, is it time to urinate? How's my bladder health? God forbid something happens where I can't urinate. The threat is unimaginable. I'm going to have to go to the emergency department. What happens if my bladder explodes? I could be in major problem, right? So he has now, out of this trauma of being unable to urinate, having to go to the emergency department, become obsessive and compulsive about urinating on a certain schedule, a certain amount, overnight, water intake, and the rest of it. So this trauma has now developed into this obsessive compulsive disorder. Now, this is very different than kind of a primary ritualistic obsessive compulsive disorder that, we often see that's portrayed in the media. If you guys want to know about
can you give us a quick one? Because I'm not even sure what you're talking about exactly.
Yeah. So there's patients that have OCD that engage in ritualistic behavior.
You're talking about like rubbing a doorknob 3 times before you open it.
Some sort of ritual.
Mm-hmm.
Like if I don't rub this doorknob 4 times before I leave this house, then my house will catch on fire. If I don't step over every single crack, then some sort of negative outcome is going to happen to me or some loved one that has nothing to do with stepping over cracks.
Mm-hmm.
So that's kind of like this classic ritualistic OCD.
Yeah.
Here we have an obsessive compulsive disorder that has sprung out of a trauma. So here's an example on how trauma can actually lead to OCD, which makes sense because trauma and OCD are both anxiety disorders. They both stem out of fear and worry.
I mean, that makes sense,
Yes.
100%.
This is that person that got into a car accident that will no longer drive. It's that person that got mugged on the street that gets agoraphobic and never leaves their house. So their body's way of it overcorrecting, right?
Mm-hmm.
PTSD is an overcorrection.
Overcorrection.
Yeah. I will not engage in some behavior that gives me any sort of risk of experiencing this trauma again. Which also, when someone has post-traumatic stress, they don't respond to safety signals. And
we talked about this a little in the last podcast too, because now their forebrain has
evidence that the worst case scenario can happen.
Yes.
So a doctor can tell you, hey, it's safe. Don't worry about it. It's actually good for you. You're getting safety signals, but you can't accept them.
You can't accept them because it actually did happen to you.
Exactly.
And it's hard to accept the fact that it was just a one-off, low percentage chance of this event happening. That's the hard part in coming to understand.
Yes. And here's I'm going to repeat it because it's important, but an important kind of feature of PTSD is that someone that has been traumatized does not respond to safety signals in their environment. I had a patient who was in a traumatic emotional relationship, for instance, an abusive marriage, physically and emotionally abusive, got out of that marriage, but was so traumatized by it. Hey, doc, I'm dating this new guy. It's safe. It's secure. He's given me these green light signals that he's committed to me, that he's not going to abuse me. And yet I cannot shake the worry that this is going to become another abusive relationship. These safety signals that my partner is giving me, I can't accept them. And I'm still guarded and won't allow myself to get emotionally close because I'm still worried that the prior traumatic incident, as far as that abuse, is going to happen in this relationship despite the safety signals in this new environment.
So that must be really tough. How do you help that?
First of all, you give them the insight that this is what's happening. Second of all, you tell them, listen, you have to listen to the safety signals, which that might mean being more emotionally close and unguarded. It might mean being more romantically and sexually open and unguarded. And engaging in this unguarded way, even though anxiety comes up, trying to regulate it, manage it with your partner, being open and honest and authentic about where you're going through, and responding to cues of reality, not from cues of prior trauma. Again, this comes back to responding to feedback from actual reality rather than some sort of catastrophic reality you're building in your brain. We touched on this on podcast 1.
Yes.
This is how people live and feel well. Let me respond to actual reality and the feedback from reality, not prior trauma.
If you're a person who's dating someone and you suspect that they're influenced by trauma, holding onto these things, what are some good things you can do? I mean, I'm assuming you're not talking to their partners.
Sometimes I am. Okay. Infrequently. What can a partner do? Mm-hmm. If I'm dating somebody that I know has a history of emotional and physical abuse in another romantic relationship, and I notice that they're guarded physically or emotionally, what's going on? I know you mentioned that you had a prior relationship that didn't turn out so well. What kind of sprang out of that? Is there any way that's impacting our relationship now? Is there any sort of signal I'm giving you that I might repeat that prior relationship? No, you're doing everything okay. It's all good. Is there anything I can do to make you more comfortable? How can I ease us into this? How can I make you feel more comfortable? Can we talk through this? Being caring, being compassionate, being understanding, being supportive.
Yes.
That's a good place to start.
Yeah, especially, yes, I agree 100%. Especially important to just make sure you don't become the bad guy.
And don't take offense because like I was saying before, trauma, it changes your nervous system. It makes you super aware of threats. Again, when the patient that is traumatized and they're hyperarousal, they're incredibly sensitive to threat. What does that mean? Something that is sensitive, it picks up on everything. I'd rather have a false positive than a false negative.
So
that's what hyperarousal is.
Okay, yeah. So in the psychiatry world, arousal does not just mean sexual arousal.
No.
It's any sort of reaction of your nervous system to any sort of external stimuli that you may find threatening.
Bingo. Goddamn. You could be a psychiatrist the way you're talking. That's what arousal is. Arousal can be sexual arousal, meaning you have some sort of there's some sort of sexual attraction mixed with arousal. An arousal state with anger can lead to agitation. So arousal certainly does not just mean sexual arousal. It means the way you aptly just described it. It's this rise in the response of your body to respond to external stimuli. That's what an arousal state is.
Yeah. That makes perfect sense.
Yeah.
Perfect sense.
So here we have examples of trauma and ways that it can kind of manifest itself in unhealthy ways.
My question is let's talk about another way that people act out in order to avoid trauma.
Yes.
That is indicative of maybe some sort of problem as opposed to a proper response, a proper protective response.
Okay. So what you just described is hypervigilance. How do people, so we talked about their threat detection, their hyperarousal. And I'm going to go through like the criteria of PTSD in a second. But what you just asked is, or described is, how do people behave and act to prevent trauma? This is what you call hypervigilance. So the classic example, take your Army veteran that has been in combat and traumatized with, combat trauma. He is now hyper aroused. He will never sit with his back towards other people. And so here you have that like hyper arousal. I need to be aware of any potential threat. The hypervigilance is somebody like just brushes up on his shoulder from behind and he turns around in an offensive or defensive stance and behaviorally and action-wise responds disproportionate to what the threat is.
He's responding like he's at war.
Exactly. Trauma, when someone is traumatized, the way they're responding is in the context in which they were traumatized, not their current context. This is what it's all about.
So that's where the disjoint comes in, right?
Yes.
Because if someone brushes up against you
at Starbucks,
you could still be annoyed and you could still find a problem with it and maybe even still talk to them and say, hey, I didn't appreciate that. Watch where you're going or whatever, right? But it's the point where it becomes a something that you may need to seek help for is if you transition back into I'm at war again.
Yes. That's almost that's like kind of diagnostic of PTSD.
Yeah.
Is the state that their body is in is still in the context in which they were traumatized. So that veteran that was traumatized on the battlefield, he is at church and his body is still responding like it's on the battlefield. He's still looking over his shoulder and looking over every corner, looking at what potential exit plans are. If someone brushes behind him, he springs into action. That's a hallmark feature of PTSD.
Yeah.
Like that prior example I gave in the relationship, she's still operating as if she's in the context of the prior traumatic relationship, despite safety signals. The safety signals, I'm in church, there's a pastor, these people are part of my community, everyone's dressed appropriately, no one looks like they're dangerous, no one's armed visibly. Hey, this guy's treating me well, he's only been good to me. They cannot respond to the safety signals in their actual environment. Their sympathetic nervous system, their fight or flight responds as if they are in the context in which they were traumatized.
So when it comes to healing this person,
Yes.
whether it be a woman who was in a previously traumatic relationship or a person who's been out at war or whatever, right? Is there some sort of wiggle room as to integrating themselves into normal society? Like, so for instance, if I was in a church and I had someone with PTSD in the audience, I might not mind it so much because if something did happen, they might spring to action and save everyone. They're already like ready to go.
Well, that might serve you, but is it serving the patient and his family?
Well, my question is there room to allow a little bit of that left in their lives? They can hold on to a little bit of that. And maybe, maybe he concealed carries into church or something like that. It's not a complete negation of it back to completely normal life, but maybe he's the one guy in the church who's ready to go.
That's an excellent question.
But
yes,
not too much.
Yes. The problem with PTSD is that it's an overcorrection. If we suffer any sort of damage to us, any sort of trauma, we have to learn from that, of course. If not, if I walk through a dark alley at night and I get mugged and held up at gunpoint, if I learn nothing from that and continue to walk through dark alleys, then let me tell you, my genes are not going to propagate. The species that doesn't learn from prior trauma and repeats the same sort of behavior that got them in trouble, that species will die out. Absolutely, you should learn from prior trauma.
And so it seems like it's very much about integrating that into life again, as opposed to completely negating it.
The last thing you want to do is tell someone, hey, don't worry about it. Yeah.
It's not going to work, obviously.
It's not going to work. And you are diminishing what they went through.
Yeah.
Which is a problem. You have to respect what they went through. You have to recognize that it's going to cause some sort of change in them, but you want them to feel in control and you don't want them to be suffering. And you want them to be able to live their life and not have to avoid environments that are benign because of their PTSD. And medications can be incredibly useful for that. Let me just run through the diagnostic criteria of PTSD. You have some sort of trauma, which we've already defined. You have this hyper arousal to threat, right? I'd rather have a ton of false positives than any false negatives. You have this vigilance towards anything, right? A disproportionate physical response to something that is mildly or not threatening at all. Usually, you have a mood component. You're irritable, you're depressed. When some sort of injustice has happened to you that has traumatized you, that can cause depression, irritability, anger, some sort of mood disorder, and you relive the trauma. You have flashbacks, you relive it in nightmares. So these are some of the fundamental features, like a mood disorder, including irritability, hyperarousal, hypervigilance, reliving the trauma, and avoidance behavior of anything that can even resemble the prior threat. Yeah, that's PTSD.
Slight tangent. Again, sorry to bring up Jordan Peterson again, but I remember him saying something about that a lot of people get PTSD not from. So don't quote me on this, everyone, but as I remember it, one thing that can happen that makes people have PTSD is encountering real malevolence. Which I think is what we were talking about. And the second thing he said was discovering a side of yourself that you didn't know about that was malevolent or cruel and now you're having a problem living with it afterwards when you're in normal life, faced with the normal context of things. You know,
Yeah.
And have you seen that too?
Well, your first point, yes. Encountering some sort of malevolent person who wants to harm or kill or damage you absolutely can lead to PTSD. As far as a person engaging in some sort of bad behavior that is completely incongruent with their values and causes damage to somebody else, yeah, I suppose that can cause post-traumatic stress. I struggle to think of any case examples with that. Usually that will lead to significant guilt, a long-lasting guilt, a self-attack, shame, depression. That's usually what I see in cases in which a person acts malevolently, again, in accordance with their own values, incongruent with that, damaging somebody else. I'm sure it could lead to PTSD. I can't think of an example of that, but I would say that's what usually springs out of that.
Yeah, so that's got me thinking about guilt and shame. I think maybe we should touch upon that a bit. We brought it up in the context of somebody doing something that they thought was outside of their value set to do. I think most of us have experienced that, at least in a slight way, when we deviate from something we want to do and feel guilt about it. Guilt and shame, how does that come into play in terms of mental wellness? And how does that manifest? Is that trauma technically? What is that?
Guilt and shame, two very, very powerful feelings. Now, guilt and shame can both be healthy and pathological. So let me start with guilt. The feeling of guilt, every single person watching, I struggle to think of any human being has never felt guilty. So when does guilt arise? Guilt is a pro-social, healthy feeling that somebody feels when they have purposefully or inadvertently caused harm to somebody else.
Against their own prescribed set of values.
Even if it's not against their values.
Okay.
If I engage in some sort of action that causes somebody to feel badly, I might feel guilty. That is a healthy pro-social feeling, and the behavioral impulse associated with guilt is to repair and reconcile the relationship. This is why guilt is a healthy feeling. Now, quick note as far as feelings, getting in touch with your feelings. So what does getting in touch with your feelings mean, right? I'm a psychiatrist. Let me tell you what that means. So a feeling, we have to describe how our body feels. We have to describe the emotion that we're feeling, and we have to describe the behavioral impulse associated with that feeling. Anger, for instance, is an easy one. I am feeling angry. My body is hot. My muscles are tense. My fists are clenched. And the behavioral impulse of it, my anger, is I want to punch this guy in the face. And feelings arise interpersonally, right? And also intrapersonally. So that's what it means to be in touch with your feelings. What am I feeling? How is it making me feel? What is the motoric or behavioral impulse associated with that feeling?
Good.
So back to guilt. Let's say I make fun of Jeff's purple shirt here, right? I can tease Jeff all the time. We've known each other our entire lives. Let's say because we're on camera and everybody's listening, his feelings get hurt on that. And I recognize that after we finish shooting. Now I feel bad. I feel guilty that I hurt his feelings, that I may have embarrassed him in front of the camera. I get a pit in my stomach. I feel guilty. I feel compelled, or I feel this impulse to apologize and repair the relationship. Again, guilt is a pro-social feeling. Now, guilt can become pathological. If I take responsibility for someone's pain that I did not have any sort of
hand in
causing, I might feel guilty pathologically. I had a patient, for instance, they were adopted. They're adopted, the family that gave them up for adoption, this particular family, her mother is abusing drugs. Her birth siblings are living kind of in poverty, abusive parents. She was adopted by an affluent family over in Malibu. She is now feeling guilty for the state in which her siblings are living in, despite not having any actual hand or responsibility for their suffering. She is feeling guilty because she's living well and they are not.
Can I ask you, is she in a position to help them or not quite yet?
She is not.
Okay.
Now, that's an excellent question. So, guilt can be healthy or it can be pathological. Shame. What do you think? How do you think shame arises? What is shame? Can you define what shame is?
When I think of shame, I think of mostly social pressures.
Mm-hmm.
So people enforcing onto you what they think is socially acceptable.
Yes.
You've deviated from that.
Yes.
And you are so tied into your social environment that their pressures suppress your mental well-being.
Shame arises when we engage in a behavior outside of our personal value system. Guilt arises when we feel like we have damaged another person. If I value education, diligence, hard work, and I am now procrastinating in school, getting bad grades, and going outside of my own value set in which I'm the only person that's negatively impacted here, I might feel ashamed of myself, despite not causing damage to anybody else. So there's healthy shame, and then there's pathological shame. The person that is pathologically shameful, they feel like there is something intrinsically wrong with them that goes against what is acceptable to themselves and other people. That is pathological shame, where people feel intrinsically wrong.
I've been seeing in a lot of modern day talks online what's going on in the general public, that at least a certain subset of the population believes there's not enough shame nowadays.
Yes.
That a lot of people are acting...
What a great point.
Bereft of shame.
Yes.
Right? I mean, positive and negative. It can be positive and negative, right?
Mm-hmm. How can it be? Well, yeah, I'll let you finish your point, then I'll ask questions.
People are acting bereft of shame, and it's resulting in actions that are detrimental to their own mental health.
Yes.
And the argument for a lot of people out there in modern society is if we just reestablish these social pressures that put shame on people for certain actions, then people would correct their actions and thereby have better mental health and then act in a more proper way.
Can you give us an example in today's society how people are acting shameless, but it's acceptable because of the way the world is working right now?
The first one that comes to mind is how a lot of influencers act online, and they'll completely destroy their home lives, their interpersonal relationships, and whatever else in the sake of a couple more likes, subscribers, whatever else.
Yeah, you're right on. In this social media and this economy of attention, the economy of attention does not differentiate between positive attention and negative attention. So if somebody on social media does something that is shameful, for instance, that OnlyFans star that just slept with 100 men in one day.
Yeah.
Because
good example.
Her metric is clicks online and attention online, which does not differentiate between positive and negative attention or valuation. All she is noticing is validation through this level of attention that she is gleaning. That is all across the online world today, they say, no publicity is bad. All publicity is good publicity, or whatever they say.
Yeah.
So if we were actually engaging in like the real world outside of this online community, it would be very different, because now all attention, including negative attention, is positive. So people are being validated and rewarded for shameful behavior, which then leads them to have that shameful behavior reinforced and continue to engage in that shameful behavior. Yeah, that might be validating online through clicks. That might be validating and reinforcing through the money or the income or the number of followers that you gain, but you're engaging in a behavior that is outside of what is socially acceptable and likely what is acceptable to you. Mind you, that's very important. The most important thing is what's acceptable to you and your value set. This particular OnlyFans model was then caught on camera, literally crying.
That's about what I was going to say is, did you watch afterwards the interviews, right?
I did. Yeah, it seemed like she was remorseful about it. It depends on her own values, but then it depends on how is this negatively impacting your life. If you are doing something that, okay, it's within your value set, but it substantially deviates from the value set of society, then perhaps you're feeling good about your own actions, but you don't live in a vacuum. You have to interact with other people. So if now she's out there looking for a spouse and dating other men, if she's looking to be part of a community, if she's looking to gain friends, and they're all judging her based on this society-wide value set in which they feel like what the behavior she's engaging in is shameful, then she might pay consequences to that, even if in her own personal value system, what she did was not shameful. We don't live in a vacuum. We're relational animals. We have to interact with other people. So we have to pay the consequences of that.
That answers my question perfectly.
Yeah.
Do you think we should get into talking about daddy issues at all?
Daddy issues.
I mean, why do you think she did it if not that? There's no way her father's in the picture, right? I don't know. I mean, I'm talking about
who knows. I mean, who knows? I don't want to speculate on her.
Okay, yeah, let's.
We have a fundamental kind of like law in psychiatry, is that we don't try to analyze people that we don't actually know. People ask me all the time, what's your analysis of they ask me to go on record, what's your analysis of Kamala Harris? What's your psychiatric analysis of Donald Trump? We have a rule. We don't analyze people based on what we see publicly, because we don't actually know these people.
Makes perfect sense to me. If you did that, you would be doing a huge disservice to the nuance of what's actually going on with people.
And as far as women with daddy issues, I mean, if people are interested in hearing about that, you can leave it in the comments. That has to do with narcissistic injury, daddy issues. My dad abandoned me. He didn't love me. So that has to do with self-esteem. And also something that we call repetition compulsion. This is part of psychodynamic theory. So someone that has been, for instance, could not acquire the love of this father who abandoned them, that was an asshole and avoidant and abusive, they will often try to repeat the circumstance in which they feel like they failed to try to gain success, which is why women with daddy issues might seek out men similar to their father, abusive, avoidant, alcoholic, to try to kind of succeed, to kind of correct their history. Repetition compulsion, a basic tenet of psychodynamic theory.
Makes perfect sense.
If people want to hear about it, let us know. We don't have to dive further into that.
All right, that concludes this talk of the...
What are we going with? Real mental health or mind matters? We're debating between those two names. Let us know in the comments. What's a better name for this podcast? Real mental health or mind matters? Or if you have any other suggestions, leave them down below.
We are totally open to all of them, but that concludes this talk, and we will see you guys next time. Thanks for joining.
We appreciate your time, Jeff. Thank you very much. We'll see you on episode 3. Thank you.